Social work in the health setting in Nigeria is not recent because even before the coming of the colonial master, the Nigerian indigenous people in Ondo State has already has existing method to render medical care to one another. And so as to cure their health issue. And as a regard to civilization, the colonial master brought about advanced medical care, which came as a tablet for health care advancement, and then introduced hospital and laboratory tests for people to access for health care improvement in Nigeria. One cannot talk about health setting without talking about professional team and interdisciplinary connection or collaboration with other professions such as social work, doctor, psychologist, and every other team that's made up the hospital. And the health setting cannot run without collaboration with any other setting. And importantly, cannot run without social work because social work is a practice-based profession and academic discipline that promotes social change, cohesion, development, and empowerment and liberation of people. The doctor focus on the medical aspect of the client and social worker focus on the social aspect of the client and the nurse support the doctor to carry out their activity and while the lab scientist investigate on the particular issue that is wrong with the client and the psychology look at the mental processes of this patient. You can see that social work and every other professional body in the health setting must collaborate so as to achieve the hospital goal. Social work in the health setting, medical social worker are health professionals who work in the health setting and they are very useful and important in the health setting and towards achieving the goal of the hospital setting. Social worker is not only important to the health setting, it's also important to the health personnel, the patient, so as to help them function socially. Because social worker help relate and encourage patients out from their impairment and also help healthcare professional to see this client or this patient as a person and not a client so as to carry out their work effective to this patient. Medical facility and social work. Medical facility and social work is a place where medical professionals work and collaborate with other professions, other professionals to work in a health facility to meet up with the goal of the health facility. Social work and the patient. Social work in the health setting work with the patient who cannot meet up with their social need, even their hospital bill. Social worker link them to NGOs or individuals who are interested in channeling their money or their resources in helping people in the health setting who cannot meet up with their social need or their hospital bill, and also helping hospitals who are not advanced in their structures or who are not advanced or in their social activities such as their medical processes. These social worker link them to NGOs who will come to their aid and enhance all the social activity so as to ensure quality health care to patients in the society. Social work with the healthcare workers. Social work educates the healthcare workers to wear a friendly face and wear the spirit of acceptance and non-judgmental attitude when working with patients so as to give these patients room to express themselves more to them so as for these healthcare workers to render effective services to this patient and for this patient to have the spirit to return back to them because in some hospital setting when you get there you may not even want to return again due to the attitude behaviour and character the healthcare worker exhibited to us or to you. Then social worker with the NGO, social worker help and meet with NGOs who are ready to channel their social resources, their money in improving healthcare facility and also helping patient who cannot meet up with their social need in the hospital. And also, social worker educate these NGOs on how to channel their money properly into the hospital setting, such as improving the hospital settings, providing ambulances, providing medical drug, free medical care for every individual, and also find a way to provide insurance package for the vulnerable people, such as the poor of the poorest, child under five, and pregnant woman in the society. Then social work with the policymaker. So work meet with the policymaker to find a way to improve community social policy that will improve the hospital setting or facility to a higher standard, and also enact a policy that will bring financial improvement in all hospitals. By example, providing free health care for all vulnerable members in the society. And also social worker educate worker also meet with policymaker so as for them to add the hospital expenses in the budget of the country. Social work and psychological factors in disease is being broken into two. We have psychological factor and social factor. I'm talking about first of all the social factor that brought about disease or sickness in our patient's life. One of them is poverty. For example, a man who cannot meet up with his social need or the basic need will not function properly because we believe that he cannot even access health care because he's poor, talking about of providing his basic need. So we'll find a social worker to help these clients enhance their social functioning. Two is personal habit. Personal habit can bring about disease in the sense that if you are into smoke, if you are into smoke addicted and drink, this might bring about disease. And illiteracy. Illiteracy is also an important factor bring about disease. For example, a client who is not educated, who does not know how to take care of his health, may be prompt to disease. And thirdly, talking about the working condition. For example, an environment where you are working that is not functioning well, that is not well defined and structured, may bring about disease. And also, in migration is another way of bringing about disease. A client or an individual who travel around the world without having proper check or isolation whenever he land or travel to any country, you must isolate yourself for some time to examine yourself if you are okay. Most times, all the pandemic issues, diseases, or viruses spreading the world, it is a result of migrations. Then the psychological factors of disease are one, emotional, two, anxiety, and three, fatalistic attitude. Problems of medical social work in Nigeria is lack of requisition of the social work practice in Nigeria and lack of social facility that we created for social worker to operate. Role of social worker in the medical setting. The roles of social worker in the medical setting is unlimited. Social worker educate doctor to see client as a person and not a patient who come to pay him or her for our service. Social worker educate doctors to help client function very well. And social workers serve as PRO in the hospital and communicating back to the patient and to the patient to the family about a certain health issue. And social worker educate the patient on the importance of what? Health care facility. And social worker help clients to cope with their health issues. Social worker also help clients carry out research on how to improve on their health session, on their health care. And social worker also link clients to available resources so as for them to meet up with their health challenge. This is just a brief overview of social work in the health setting. Don't forget to like, share, and subscribe.